The title of my topic for today is on healthcare financing and the healthcare system in Nigeria. I've got about 7 points that I'm going to cover, and at the end, I'm going to be making a recommendation for where I think the healthcare system of Nigeria should go or will be. So, Nigeria is located in the west of Africa, and it's got neighboring countries such as Cameroon, Chad, Niger, and Benin Republic. It's the most populous country in Africa. It's got over 2 million inhabitants. It's considered to be a lower middle income country, although the economy is growing every year at a rate of about 2.5%. The GDP has consistently grown over the past few years. For example, in 2017, it was 375.75 billion, and in 2021 it's expected to grow to 466.8 billion. The GDP per capita again has increased over the past years, and of course is higher than those of the neighboring countries. The country is governed by the federal, state, and local authorities. The urban population is 52%, and the life expectancy at birth for males, it's recorded at 54.8 years. For females, it's 56.8 years, and for both sexes, it's slightly higher. So, in terms of how healthcare is financed in Nigeria, there are several sources, but the main players are the federal government, the state ministry of health, and the local government wards. Other key notable stakeholders include the NGOs, different donors, and of course, health maintenance organizations. There are different types of health insurance programs in Nigeria, but only less than 5% of the population actually has any form of health insurance. Back in 2005, a scheme was introduced that would make it mandatory for every single citizen to have health insurance. It was called the National Health Insurance Scheme. But of course, as the data shows, only 3 to 4% of the population actually took advantage of it. The program was made to cover primary care and referral care to accredited healthcare facilities. The other types of health insurance that there are the community-based health insurance, the state-supported health insurance, and of course private health insurance scheme, which are run by health management organizations. And they target clients who in particular have the means to pay perhaps on a health insurance plan, and it mainly covers primary health care and some secondary and tertiary care as well. The next slide that you're looking at basically explain how money is pulled together from different sources into the national healthcare pocket, and how this money is used to buy different services for the population. For example, employees are meant to contribute a certain percentage of their salary, which is aimed at 1.75% and can be increased voluntarily to 5%. Employers do the same. There's a percentage of salary that needs to be deducted, and this can go up to 10% as a voluntary scheme. There are other sources of revenue from self-employed or the rural community, and of course, like it says in their donors. All of this money gets pulled into the formal sector health insurance program, which I referred to earlier on as the National Health Insurance Scheme. And in turn, this money is then used to pay health maintenance organization, and they in turn use the money to buy public or private services, and of course they collect contributions and make payments accordingly. What does this money buy in terms of services? Well, one, it could be payment for healthcare providers, whether at the primary, secondary, or tertiary level, and administrative cost, overheads, and of course personnel. The previous slides show that Nigeria's economy is growing year on year, but the problem is that the amount of money that is set aside for healthcare is really low. And this is a mirror image of what happens in most African countries. Compare that to Western countries such as Sweden, that sets aside 15% of the total GDP for healthcare. Likewise, the Healthcare expenditure per capita in Nigeria is $232.99. Again, these are very low considering the fact that people need all manner of healthcare services, and the fact that most of these healthcare services have to be bought in or paid out of pocket. So the question is, why is the case? Well, the first thing is that there are communication gaps between the federal, state, and the local, and they just find it very difficult to agree a common ground or policy agreement that will be to the benefit of the average Nigerian. This next slide talks about the levels of care and responsibility, and similar to what happens within the UK healthcare system, for example, the healthcare system in Nigeria is divided amongst the three governmental areas: the federal, the state, and the local government. For example, the federal government takes care of all tertiary care, of which there are 47 teaching hospitals. The state government looks after secondary care with well over 3,000 district hospitals, comprehensive health centers, specialist and general hospitals, whilst the local government carries the bulk of all the primary healthcare services, over 29,000 dispensary and health posts, health centers, clinics, and the likes. And these are dotted all over the country. So, given the challenges and the opportunities that exist in Nigeria with regards to the provision of universal healthcare coverage, back in 2005, the World Health Assembly came together to urge all countries to adopt a universal healthcare coverage. Interestingly, Nigeria being one of the countries that signed up the Abuja Declaration, along with other 53 African countries, pledged to increase their healthcare budget by 15%. But records show that not all of them have actually honored this. And the sad part is that almost 90% of all healthcare budget are now met as an out-of-pocket spending amongst most African countries. The constraints, of course, in achieving a universal healthcare coverage is as follows. It's just simply down to the fact that there is not enough finance that have been invested, and of course there is inadequate infrastructure, poor service quality, there is lack of training for most medical personnel, there is weak government or weak governance to be able to enforce good clinical practice, and generally speaking, most household individuals are not able to afford good quality health care. I hope I've been able to demonstrate that there is a great need for universal health coverage in Nigeria, not least the fact that the economy is growing. But what is important is that we need to first of all take an evaluation of existing services to see what is working and what are not. Secondly, there is a need to encourage all aspects of the federal, state, and local authorities to adopt the universal health coverage policy, and most importantly, to commit more funding. According to Adebisi et al., they said that this would drive several objectives, one of which is equity to healthcare or services. Now, healthcare equity or equity in healthcare is defined as the absence of socially unjust or unfair health disparities. To make it more clearer, some authors have defined it as the absence of systematic disparities in health or in major social determinants of health between social groups who have different levels of underlying social advantage and disadvantage, that is, different position in a social hierarchy. Put simply, that everybody should be able to access healthcare, not just for the rich and the privileged. Secondly, there is a need for financial protection so that people are not worse off for seeking healthcare services, especially those in rural areas. Thirdly, there is a need to improve infrastructures and personnel and to ensure the availability of medicines to diagnose and to treat diseases. So in conclusion, these are my recommendations. One is to replace the out-of-pocket financing for healthcare. Two, to establish a national health account sector to manage public contributions and prevent mismanagement of funds. Three, regular training of personnel, of healthcare personnel. Four, health education to be taught at community and household level, preferably maybe using celebrities and avoid duplication of government services.